Hello, this is Dr. David Greene, CEO of the Nevada Pain Network. The topic today is the basics of superior hypogastric plexus blocks. I know that's a mouthful to hear, but it's actually a very basic procedure. What is a superior hypogastric block? It's an outpatient injection performed by pain doctors that may provide excellent pain relief for numerous types of pelvic pain. For those who are suffering from pelvic pain, opiate medications may not work very well. You may need to take them in large doses for effectiveness, and that can cause complications such as addiction, tolerance, constipation. So this type of injection can lessen the need for those narcotics dramatically. What is the superior hypogastric plexus? It's a bundle of nerves situated in the area where the aorta splits at the bottom of the lumbar spine area. So you have the aorta coming down, and then it splits into the iliac vessels. And right around there is where the superior hypogastric plexus sits, and it provides sensation to a plethora of organs in the pelvic region: rectum, bladder, prostate, vagina and vulva in women, penis, testes, descending colon, uterus, urethra. Who does well with a superior hypogastric block? Well, if you're having pain from any one of those areas that it provides sensation to, it can really help. And we just went through that list, bladder, urethra, uterus, and then so on and so forth. It also can provide relief for endometriosis, those who have scar tissue from previous procedures in the pelvis, those with radiation injury or cancer of the pelvis, irritable bowel, interstitial cystitis. How is the injection performed? Well, pain doctors will use image guidance from fluoroscopy, which is a real-time form of X-ray. Patients are placed prone on a table that's radiolucent, meaning that X-ray beam can go through the table so they can see where the needle is. Sedation is typically used, and then numbing medicine is provided from the skin all the way down to where the needle sits. And usually 2 needles are used so the plexus can be numbed from both sides to get a better result. Once the needles are in place, dye is injected to make sure it's accurate and that it's not in a blood vessel. And then once that is confirmed, then numbing medicine, maybe some steroid medication, and possibly phenol, which is a type of alcohol, can be injected to take care of long relief for the pain. The procedure overall takes around a half an hour. Are there risks with the injections? The risks are small but real. There's a risk of infection, bleeding, nerve injury, maybe anesthesia complication. There's a slight risk of cortisone causing increased blood sugar, maybe some low blood pressure for a few minutes. It could be a large vessel puncture. That could always happen. Overall, it's a low risk profile, less than 1%. What are the outcomes of the injections? Well, studies show that 70% of patients receive tremendous benefit, and that's for any type of pelvic pain, so it really does help a tremendous amount of conditions. Studies show typically there's a 50% reduction in pain on average and 40% reduction in the need for narcotics. And the injection can be repeated every few months as necessary with the expectation for continued good results. Nevada Pain has the top pain management clinics in the Las Vegas, Summerlin, and Henderson areas. They accept over 50 insurances with the board-certified pain doctors who offer both medications and interventional pain treatments. There's also chiropractors, acupuncture, spinal decompression. The docs have won the Patient's Choice Award 5 years in a row. Remarkable. The number to call for scheduling is 702-323-0553. And visit us on the web at painmanagementlasvegas.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.